So our first speaker this afternoon is Jason Wallace from Scottish Drugs Forum. Now, I know Jason well because he was a very faithful and active member of the Scottish Drug Deaths Task Force. So all the good things in the report are because of Jason's contribution. He's a Senior Development Officer at the SDF, and he leads and manages the Living Experience Engagement Team, which is what we're going to hear about. He oversees peer research projects and was managing the naloxone peer education program. My note says that he's published a number of research papers, and I have a long list here that would take up half his allocated time if I were to read it out. So please give a very warm welcome to Jason Wallace.
Thanks, David. Nice to see everybody. I'm going to talk a wee bit about the importance of the living experience voice and having that sort of voice around the table and that perspective. So, first thing to say about this initiative is, it isn't a service. We're not providing a service to people in the sense of what you would see as an everyday service. The easiest way to sum this up is we're providing a safe space to people who are actively using substances. And that safe space is for them to come along, have their voice heard, raise any concerns in terms of access to services, barriers, stuff like that, but also to share some of the good news stories with. So people will say, oh, is it just a bit of a moaning show and stuff? It isn't. So we encourage people that if you raise a concern or a barrier, think about the solution to it. Because we don't want to just be going back to alcohol drug partnerships, task force when it was in existence, the National Collaborative, and just saying, this is all the stuff that doesn't work. We want to begin back and sharing some of the stuff that is working so that we're able to scale that up in other parts of the countries. So the groups are all facilitated by SDF staff in my team, but also partners for third sectors who have their own lived experience. And that's dead important because initially when we set this initiative up, almost 3 years ago now in Glasgow, we did have some people helping co-facilitate the sessions who never had lived experience, and the feedback we got for the attendees and stuff is they felt it a wee bit more challenging to be fully open and honest with people. They felt a lot easier to engage with people that they knew had their own lived experience. So that's an important part of the initiative. And what it's really, as I said there, is we're providing a safe space, but it's about these individuals. There's no conditions to attending the groups, right? And that's some of you'll see, there's a wee quote later on, that's some of the positives that people have told us, that this is the first time they've ever been invited to a group like this where there's no conditions put against them. So they don't need to be stable, they don't need to be abstinent, they don't need to be any of these things. You can inject in a lane and come into your group 5 minutes later. And the staff are skilled enough and experienced enough that will look after you. And what I need to say is, in the groups we've got established and for the very beginning, we've had no issues with anybody overdosing in our groups, right? None. We've had people heavily intoxicated and we've looked after them. We've maybe took them out the group and looked after them for a wee bit, but we've had no issues, because that was a big worry at the beginning. What, you're going to invite people that's injecting drugs into the group? What if they overdose and die? Well, it's not going to happen, because we're there, we're watching for it, we're experienced, we know how to respond to it. So that's just a natural worry people can have, but it's never came to anything. What we want for these individuals is not just to attend the group. That's not good enough. We want these individuals to be coming to the group, but we want them to be part of your decision-making process. And when I say your decision-making process, I'm referring to the government, the National Collaborative, the Alcohol Drug Partnership, in the commissioned third sector services and the statutory services. These guys and lasses that are attending are what we would say the people at the coalface. We need to provide an opportunity for them, no matter where they're at in their life, to come and tell us what the barriers and challenges are, but also the positives. Because this is a group that have been looked over and missed for such a long time, and I understand some of the challenges why that is, because people worry about, oh, if somebody's just injected cocaine or heroin, could they actually engage in this? Would they know what was going on? And the answer's aye. The answer's aye. It doesn't matter how intoxicated the boys and lasses coming to the groups are, they're still able to fully articulate what their needs are. They know exactly what the barriers and the challenges are, but more importantly, they know the solutions, and sometimes they're really simple. They're really simple. They don't require 6 meetings to discuss risk assessments and all this planning. They're just really simple actions that members of staff in the service can take that would make the biggest amount of difference to people. So for every new group and the existing groups that we set up, what we do is, as soon as they're in the door, we start the process. Once the group's been meeting for 2 or 3 weeks and we identify, oh, there's Paul, he's been here every week, there's Jim, whoever, we start the process of training. And that's just a wee snapshot of training. So the first thing we want to do with them, wee bit of drug death prevention, naloxone, gear them a supply, make sure they leave our group that day with a supply. Even if they say, oh, I talked to John, he's gave me 5, well, we'll give you your 6. Because we want to be confident that you've no left our group without a supply and something happens tonight. We'll talk to them about the match standards. We don't go into depth with that. What we have is a wee sort of simplified version, if you like, of the match standards and how it might impact on you as an individual. And we talk them through each standard, and we tell them this is what might support you in terms of prescribing, accessing, IEP, that type of thing. Oh, I'll click forward there. And for most of the groups, we spoke to them about advocacy, but we talked to them about the importance of independent advocacy, because people say, oh, I've got a member of staff that advocates for me, but often that member of staff, that isn't a role within a service. They're just advocating. They're going the extra mile for people, but it's not our actual job. So we try and tap them into local advocacy services in their area, which that is what they're funded for, to provide that. We always look for the local BBV team, get them done. We don't do the training, we'll get them done just to do a wee half an hour, 40-minute discussion on BBVs, talk people through what the new treatments are and what's available. And some of them might come to the group and talk to them on a Wednesday, and they might start the treatment the next Monday. And you would be amazed the amount of people that we work in this area and we're in touch with lots of people. So we're fully aware of what's out there, but you would be amazed the amount of guys and lasses that come through these groups that are still talking about interferon and stuff like, oh no, I heard somebody went through that interferon that was horrendous. And you're going, listen, there's a whole range of new treatments. And we just do a wee bit of poly-drug use with people. We like to talk to them about, especially the street volume, so it's dead important. Most of the harm reduction up to now has been around diazepam, but it's dead important these guys and lasses know that the street volume they're buying, most of them don't have diazepam, most of them is atizolam, but it's dead important that they know the strength of atizolam and how it works differently to diazepam. Because then it's not to stop them using them, it's to allow them to adjust their use accordingly to take that into consideration. So when we're out doing the groundwork, we're now getting opened up and getting out and about, so it's always good to get out in the street, boots on the ground, go and meet people face to face, tap into the local knowledge. There's always somebody you know in an area. What you might have worked in it, you know they work in it, somebody that maybe uses in it. tap into the local knowledge, what's happening, where will we find people, what time of day, that type of thing. We always try and go and visit any potential venues for the group. And in the team we talk about, get a feel when you go into the venue, how it feels for you. Because if you walk in and you don't feel that comfortable, you can't expect anybody else to feel comfortable. So get a feel for the venue before you look to just set up a group and then it becomes somewhere it's challenging for people. Explain clearly to people when you're out and about talking to them the intent and the purpose of it, know what I mean? And a big thing is don't make promises you can't keep to people. Because the minute you promise one thing, they'll remember, and if you don't deliver it, that's what they'll judge you by. So we're quite clear with people. We're not a service. We're not going to get you into residential rehab, own a script, mental health. We're not going to do any of that. But if you come to the group, we might be able to get people aligned to the group who can do it for you and chat you through it and stuff. So I just put that, listening is one of the loudest forms of kindness. When people come to the group, we try and set the scene for them. We make sure right at the very beginning that they totally understand that this group belongs to them. It's no our group, it's no SDF's group, it's no turning points, it's no weird what, it's none of our. We're simply there to help facilitate the discussions. This is their group. So they set their own agendas. They tell us what's important to them on that given day. And then, as you can see there, we'll explore a lot of that stuff. And at the end of it, we'll chat with the people at that group and say, right, so let's just clarify. Do you want us to raise stuff about housing, prescribing, advocacy? Aye, okay, that's what we'll feed back to the ADP or whoever. So they have full autonomy of what that group looks like. We have had some challenges in different areas, and people will be aware of this. There is still a bit of a challenge of people's understanding of lived and living experience. People just say, oh, is it not just the same thing? You know, just set up one group and invite them all to it. And you go, well, no, really, because there's very different needs for the living experience to the lived experience, who might be a wee bit further down the road, maybe a couple of years or whatever. They've got very different needs to the guys and lasses who aren't engaging with services. Some ADP areas, it is quite challenging in the sense that you don't have a local services. Some of the maybe more rural areas, so you can moan and say, oh, terrible services in Glasgow, Edinburgh, Aberdeen, all of this. But actually, when you start to get out into the sticks, you're a bit more appreciative of what you've got in the big cities. You don't have a wide choice of 6, 7, 8 different services. And we certainly had a challenge in one area with us. So everybody that comes to the engagement group, we give them a £10 pay point voucher. Right? We just either send it direct to their phone or give them a hard copy of it. They go into any pay point store, redeem it for cash. Well, you can't give them money. What if they buy alcohol or drugs with it? Oh. So, people who have been doing that, and I'm looking at John, who have been doing that for a while with the WAND initiative, will know that that's the right thing to do. Doesn't matter where people are at in their life, they've got a right to be paid the same as everybody else. Because see, if you leave here the day after coming to the conference and you get a wee email for HR and they go like that, we're just going to give you your wages and Tesco vouchers this month. How would you feel? So it's just about having that equality for people. They're coming along, doing lots of training, exact same level of training staff would get. So it's only right we pay them for it. So some practical barriers, transport, stuff like that. And I'm looking at Jim, because we had this issue in the Glasgow group. So we had a group one day and there was 12 or maybe 13 people in it. And they all raised issues about bus passes. And I'll take no credit for this, it was down to Jim Thompson in the hub. So we sat down and said, right, let's look at what benefits are you on. And through doing that simple task, Jim was able to support more than half of that group to apply and get a bus pass. Now that's the simple things that you can do without having loads of big meetings about. that you just say, what benefit you on? All right, you're entitled to a bus pass. So we don't need a mental health nurse to sign the forms, no. You're entitled to it through your benefit. So it's just simple stuff like that. It makes it so much easier for these guys and lasses to engage. And this is what I'm just keeping my eye on the time here. This is what the attendees tell us that they want. And it's dead simple. It doesn't cost funding or nothing. They just want to be treated with dignity and respect, the same as everybody else and everyone else would expect. They want a chance to participate in their own treatment and support. They also want to be able to share their learning. So that's the thing that a lot of people forget, that these guys and lasses have been doing this, some of them for 30, 35 years. Now, I know it can be difficult sometimes if you're a member and a staff in a service and you're maybe talking to a client and they're talking about injecting coke or whatever and you know nothing about that. You tend maybe sometimes not to really want to have the discussions because it's like, I should know because I'm the member of staff. Don't allow your mind to block you for learning. These are the best people to learn for, these guys and lasses. If you don't know, it's all right to say, I don't know nothing about it, but I know you've been injecting it for 10 years. Tell us a wee bit about it. You learn some fantastic stuff. They want to be part of the decision making and they want to help to recruit their own peers. So the Glasgow group, longest established, see if these guys could date tomorrow, they would just go in the town, sort of outreach, they'd pick up all the injecting equipment, they'd go out in naloxone, they'd do BB, they'd just do everything and anything for nothing. We can't do that, but there comes a point where voluntary is voluntary because it benefits the individual, but then there comes a point, some of the stuff these guys and lasses do require payment, and we need to dig deep and start paying people for that and no relying on their kindness. I'll quickly run through these. So just a cut of quotes for all different individuals at different groups. This was one of the boys for the Glasgow group when we were talking about, they went and met with Alan Muller and some of the other guys for the National Collaborative, and he said, I hope that the people in charge are serious about all these changes. And they welcomed them, all the groups have welcomed them, because they know without them, they don't want to be having the same services that we've had for 15, 20 years. And this was just a wee bit about people talking about wanting to have their own journey instead of staff telling them, this is what your journey's going to be like. We'll put you on a script and we'll detox you and we'll get you abstinent and then you can do voluntary for us here, there and everywhere. People just saying, just let me choose myself what I want to do. Just allow me to have that choice. And this was some of the positive stuff that people talked about, wanting to just be able to stand up for their peers and be treated equally. People want to get proper qualifications and to be able to work in this field, right? If you get a wee chance, so no mind me giving them a wee shout out here. We've got Alex and Kevin here, who are part of the City Centre engagement group. So remember, these guys came to this group a year ago, and when they came to it, they met the requirements exactly, chaotically using on a daily basis in the city centre. Now we're less than a year down the line and these guys will start their SVQs next month. Fantastic, eh? Because we never set out to put these guys through it and say, oh, we'll sculpt them and mould them as workers. We just gave them a safe space. And they came along, knowing the guys you see the day weren't the guys that came to the groups. And they came along and they watched other people in the groups and they heard people talking about going on methadone and then changing to Esprinol and then Buvidal and then some of them becoming absent and they said, oh, I'm going to try that. We were just there at the right time to give them a safe space, provide them with the opportunities, and we'll see them. I was kidding them on earlier. Next SDF conference, the two of them will be up presenting. But I'm only really kidding. So I'll just finish with this. Just remember that the day you plant the seed isn't the day that you'll eat the fruit. Be patient, be humble, just keep moving forward. and know that all this hard work you're putting in and day out, when you're burnt out, is going to produce the results that you're looking for. Your time's coming. Don't give up. Thank you.